Good day everyone. In this video, I am conducting a lecture about drugs use and drug addiction. In this topic, we will be gaining valuable knowledge relative that we will be talking. So I would like to introduce myself first. I am Risa Kilantang. What are drugs? It refers to any chemical substance used as a medicine or in making medicines, which affect the body and mind and have a potential for abuse. They include prescription medicine, over-the-counter medicine, alcohol, tobacco, and illegal drugs.
What is drug use? Drug use is dangerous. It can harm the brain and body, sometimes permanently. It can hurt the people around you, including friends, families, kids, and unborn babies. Drug use can also lead to addictions. Examples of drug use is anabolic steroids, club drugs, cocaine, heroin, inhalants, marijuana, and methamphetamines.
What is drug addiction? Drug addiction is a chronic brain disease. It causes a person to take drugs repeatedly. Despite the harm they cause, repeated drugs use can change the brain and leads to addiction. The brain changes from addiction can be lasting, so drugs addiction is considered a relapsing disease. This means that people in recovery are at risk for taking drugs again, even after years of not taking them. Does everyone takes drugs become addicted? Not everyone who uses drugs becomes addicted. Everyone's bodies and brains are different, so their reaction to drugs can also be different. Some people may become addicted quickly, or it may happen over time. Other people never become addicted. Whether or not someone becomes addicted depends on many factors. They include genetic, environmental, and development factors.
Who is at risk for drug addictions? Your biology. People can react to drugs differently. Some people like the feeling the first time they try a drug and want more. Others hate how it feels and never try it again. Mental health problems. People who have untreated mental health problems, such as depressions, anxiety, or attention deficit or hyperactivity disorder or ADHD, are more likely to become addicted. This can happen because drug use and mental health problems affect the same parts of the brain. Also, people with these problems may use drugs to try to feel better. Trouble at home. If your home is an unhappy place or was when you were growing up, you might be more likely to have a drug problem. Trouble in schools, at work, or with making friends, you might use drugs to get your mind off these problems. Hanging around other people who use drugs, they might encourage you to try drugs. Starting drug use when you're young. When kids use drugs, it affects how their bodies and brain finish growing. This increases your chances of becoming addicted when you're an adult.
What are the signs that someone has a drug problem? Signs that someone has a drug problem include changing friends a lot, spending a lot of time alone, losing interest in favorite things, not taking care of themselves, for example, not taking showers, changing clothes, or brushes their teeth, being really tired and sad, eating more or eating less than usual, being very energetic, talking fast, or saying things that don't make sense, being in a bad mood, quickly changing between feeling bad and feeling good, sleeping at strange hours, missing important appointments, having problems at work or at school, having problems in personal, family relationships.
What are the treatments for drug addictions? Treatment for drug addictions include counseling, medicines, or both. Research shows that combining medicines with counseling gives most people the best chance of success. The counseling may be individual, family, and or group therapy. It can help you by understand why you get addicted, see how drugs change your behavior, learn how to deal with your problems so you won't go back to using drugs, learn to avoid places, people, and situations where you might be tempted to use drugs. Medicines can help with the symptoms of withdrawal. For addictions to certain drugs, there are also medicines that can help you re-establish normal brain function and decrease your cravings. If you have a mental disorder along with an addiction, it is known as a dual diagnosis. It is important to treat both problems. This will increase your chance of success.
If you have a severe addiction, you may need hospital-based or residential treatment. Residential treatments programs combines housing and treatment services. Can drug use and addiction be prevented? Drug use and addiction are preventable. Prevention programs involve families, school, communities, and the media may prevent or reduce drug use and addiction. These programs include education and outreach to help people understand the risks of drugs use.
Say no to drugs.